Welcome back to the channel, everyone. Today we're continuing our series of interviews with dental specialists about how they became a specialist and what their particular specialty is like on a day-by-day basis. And I'm thrilled to be interviewing Dr. Amanda Phoon Nguyen from Perth. And she gives a very frank and detailed interview of what it's like to be an oral med specialist. Stay tuned. Well, look, thanks so much, Amanda, for coming along and joining us. As you know, we're doing a series of interviews with all the different specialties, and there's 13 of them registered in Australia. And guess what? You're the oral med one that we're going to be talking to. So, look, I'm sure a lot of people know you from your social media, but if you can just kind of initially tell us exactly what you do and where you are and what your current practice is.
Yes. So my name is Amanda Phoon Nguyen. I'm an oral medicine specialist. I am based in Perth, Western Australia. I used to do visiting oral medicine services for Darwin, but I've recently taken a pause from that. I am the chair of the Royal Australasian College of Dental Surgeons WA Regional Committee. We do have an upcoming conference in Cairns, which is the RACDS convocation. We call it the Financial Dentistry. I'm the chair of the scientific committee. I'm part of the organizing committee. I do a bunch of things on the side. So I do quite
Mm.
like to get involved in the different associations and committees. But
Mm.
essentially, I work in oral medicine in private practice. I also have public appointments as a senior lecturer at Curtin University, and I'm a consultant at the Perth Children's Hospital.
Yeah, great. Look, yeah, I mean, I had a look through your CV and it's just chock-a-block. Honestly, I don't know how one person, this looks like enough CV for about 10 people. So all those things that you do are just incredible. But we'll kind of get to that as we move along. But look, what I really want the viewers to get from this is just get the flavour of what it's like to become an oral med specialist. What's it like through the university course and your day-to-day life, and just so anyone who's thinking of it can get a bit of an idea of whether it probably is something for them or not. So let's go back to the young Amanda before you even started dental school. Okay, just give us a brief background on where you were raised and kind of what you did before you went to dental school.
So I was actually born in Singapore, and I only moved to Australia when I was year 10. So I did year 10, 11, and 12 at
Okay.
a local girls' school in Melbourne. And growing up, I never thought I wanted to be a dentist. That sort of wasn't really on my radar. I actually wanted to be a lawyer, believe it or not. And then I dabbled a little bit about maybe I want to do some, traveling and things like that. But then when I was in when I was in year 10, I had a older friend who was actually doing dental school at the time. And she would talk about it. And it seemed really interesting. So then I decided to look into dentistry, and then, as they say, the rest is history. But yeah,
Mm,
interestingly enough, I'm like, how some people wanted to grow up to be a dentist. That
yeah.
really wasn't anything that sort of hit me until year 11 and year 12 when I saw someone else doing dental school.
Fair enough. Look, it's never too old to do law. I actually finished it a while ago, and last year I finally was admitted to the Supreme Court of New South Wales and have a practicing certificate. So it's something you can still do if you really want to go down that avenue. But it's a good
Maybe
way
I'll
to
try it.
it's a good way to ruin your social life for about 5.5 years. Put it that way. But anyway, yeah. So where did you go and do dentistry, and what type of course was it? Was it postgrad or undergrad?
Yeah, so back then when I was doing it, they were all undergrad. So I did it as an
Mm.
undergrad course, and I did it through the University of Melbourne. So because I was based in Melbourne at the time, so it was a 5-year undergraduate degree, and I don't mind admitting this, and people who know me from back then know this is true. I was not a great student at all, because coming straight out of year 12, I didn't want to do more study. First time in university, surrounded by different people, new friends. So
Mm.
I didn't really buckle down and study dentistry properly until my final, like, last few years when it started to get pretty close to the fact that I would have to graduate. So yeah, unfortunately I wasn't an amazing student in dental school,
Mm.
but I had a really good time. And I think the things that
Well, that's the
probably
main thing.
yes. But one of the things that I do remember was that when I was learning oral medicine back as an undergraduate at University of Melbourne, I always thought it was very interesting the thought of specialization actually honestly never ever occurred to me until I had been working as a general dentist for a few years.
Mm,
But yeah, even back then I thought it was pretty interesting. Never thought I would make a career of it, but there you go.
mm. Well, you got there, obviously. You finished. I mean, obviously, you socialised a lot in the first few years. But look, that's actually, in my mind, a really important part of uni. I look back to I went through Queensland Uni, and yes, you got to do the work, you got to pass, you got to get through it all and whatever. But the memories and experiences and the friendships developed back then, it was just an amazing time. And I hope everyone going through uni, kind of had that situation.
And the reason why I bring that up is because every so often, because people talk to me about wanting to specialize every so often, and it seems to be a common thing that people can feel that if they didn't excel in dentistry, or if they weren't sure what they wanted to do in dental school, if they weren't someone who always wanted to specialize, that it seems to be off the cards for them. But from my personal experience, that's
Mm.
definitely not the case.
Mm.
So even if you weren't a great student in, in dentistry, that doesn't mean that you can't specialize.
Mm. Yeah, no, that's a really good point because I think a lot of people do think that if that to specialise or to do further studies, you must have been right at the cream at the top of the milk there, but that's absolutely not the case. You just need to be determined, quite frankly, and that's how I found nearly everything I've done. It's just a matter of being determined and keep going.
And do it,
Um,
yeah,
just don't
exactly.
quit, and somehow you end up getting to the end of it. Yeah. So you finished. In what year did you finish dental school?
So I finished in 2011.
2011. And so, what did you do immediately out of dental school?
Yeah, so I actually joined the Royal Australian Navy as a dental officer because
Okay.
I've always wanted to do a gap year.
Mm,
I didn't want to graduate dentistry straight away and go straight into doing full time dentistry. I wanted
mm,
something a little bit different, and I didn't get the opportunity to do a gap year. So joining the military actually really appealed to me in that sense. So I actually joined the Royal Australian Navy as a bonded undergraduate. So they paid a little bit towards my studies for the last few years, and in return, I worked for them when I first came out. So I
right.
did officer training, which had nothing to do with dentistry, and then I ended up working in Sydney actually on base
Mm.
as a dentist.
Oh, well, that's amazing. I didn't know that about you, and I had the same thing. I had an undergrad scholarship for the last 2 years at uni, and I was in the army.
Yes.
And yeah, I mean, I had it for the last 2 years, and so I had a payback of 3 years. But I ended up enjoying it so damn much. I hung around for another 15 years.
Wow, very
Yeah, I
cool.
know. Yeah,
Uh, there's,
yeah.
there's a little bit of a joke about how the Navy people sleep on ships, and the
Mm.
Army people sleep in trenches, and the Air Force people sleep in five-star hotels. Have you heard that one before?
I've heard that, and there's a little bit of truth in that. Sorry to all the RAF people listening, but yeah. So I found being in the military straight out of dental school absolutely fantastic because you had people around you, mentors. You didn't have to worry about what treatment you did. You didn't have to worry about costs. You just had to do the best treatment. Is that your experience?
It was. So that was a very big part of why it was very attractive as well.
Mm,
Back then, I don't think it is the case now, but back then we had specialists actually working in rooms on the base, visiting
mm,
specialists. So
mm,
I would follow them around. They never minded me hanging around. And, patients were really easy because you didn't have to discuss costs with them. Most times, whatever needed to be done would be done. So I found that a great start to dentistry.
Okay, so you're in there for a few years. Then you made the decision, oh, I've done my time back. I'm going to get out. So was it, what did you do then? More private practice or did you go straight into your specialist training then?
So I actually met my now husband when I was in the final few years of dentistry,
Mm,
and he is from Perth, Western Australia, which is where I am now.
mm,
So he is in the oil and gas industry. So it made a lot of sense for me to actually make the move over to Western Australia because it was
mm,
much easier for me to find a job as a general dentist
mm,
here than for him to find a job in Melbourne. So
mm,
I ended up taking a bit of a leap of faith, moved over to Perth. Thankfully, it all worked out. So we're still together. We're married now. But
mm,
yeah, I sort of left people behind and left everything I knew actually and moved to
mm.
Perth. Yeah, and then when I was in Perth, I started working in public and private practice as a general dentist for several years. I did buy a dental practice when I was 23,
Oh, that's
which
young.
was Yeah. Oh, look. To be honest, this is another bit of advice that I have if anyone
Mhm.
ever felt the same pressure that I did, because I always thought that owning your own dental practice was the way to do it in general dentistry. But I never really considered my circumstances and my personality and my strengths, to be honest. I'm not a numbers person. HR used to stress me out. Bookkeeping I could not do. IT issues would make me go crazy. So I was actually not suited to own a dental
Yeah,
practice.
because some of those things are pretty important owning, owning a dental practice.
That's it. But I was so young, and I thought, and I had someone offer me the opportunity. This was a person who was like, "Look, I'm a businessman. Come and join because I'm opening up a dental practice. You take
Mm.
care of all the dentistry and the clinical aspects, and I take care of all the business aspects."
Mm.
Now, many years in, well, not many years now, in hindsight, I know that that was a terrible idea because we ran into so many issues. With the lease, the practice never had a proper lease. We were being overcharged for many things, and basically all of the business things were not done properly. And I had absolutely no idea because I was so young, and
Mm.
I really jumped into it without considering it carefully.
Mm.
And obviously, I think that was because I was young and naive, and I was quite excited at the thought of owning a dental practice. But I
Mm.
very soon realized that that was not the path for me.
Mm.
Luckily, we managed to sell the dental practice, and the partnership was dissolved. And
Okay.
then around that time, I actually had done a membership through the Royal Australasian College of Dental Surgeons, called the MRACDS GDP. I sort
Mm.
of did it because I wanted to do something a little bit more, to have a little bit of structured learning to keep me interested. And I think it was around that time that I realized that I actually did quite enjoy it when it wasn't at a sort of undergraduate university sort of level, where I was learning now for the sake of wanting to learn for myself. And then
Right.
that's when I started to think about specialty.
Yeah, so you did private work and you did some public, and in the public you started to see a few things that may have been of interest. Is that
Hmm.
right?
Yeah, so I was actually interested in oral medicine and pediatric dentistry. So those
Mm.
were the two things that I was
Right.
thinking about. Um, and then I started to reach out to a few of the dentists that I had met in Perth, keeping in mind that I didn't know them well at all because I had only just moved over, um, and like didn't I didn't really have networks here, but a few of them were kind enough to offer me like shadowing opportunities where I could
Mm.
go into the public oral medicine clinic, for example. And through that process, I started to understand a little bit more about the specialties that I was interested in, and ultimately I could make my decision.
Okay, so in the end, you were in Perth for what? What about 3 years? Was it private practice and public before you started to
So
specialise?
yeah, so I was in Perth from about 2012, 2013, and I
Mm.
only started specialty training in the middle of 2016.
2016, rightio. So you made the big kind of leap and decided I'm going to do this. So that the next 3 years were mapped out. So tell us about what that was like. What's it like doing oral medicine? How was it structured? What are the good points? What are the bad points of studying oral medicine?
So I don't. I'm imagining that this is the same across a lot of the different specialties. And if anyone who is in specialty training is listening to this, don't worry. It is very normal for you to feel like you know absolutely nothing. So this is what one of my colleagues told me, and very experienced. He's retired now, periodontist, and he basically told me that the first year is where you realize everything you do not know, and you basically work as a sponge and you absorb every little thing that you can. There is actually not a whole lot of independent thought in the first year, because whatever your consultants tell you, you kind of like agree and do because you don't know any better. So the first year is where you get the breadth of knowledge in your specialty.
Mm.
Second year is where you start to go a little bit deeper. So you sort of start to question why different consultants do different things. And then you sort of consolidate your knowledge a little bit more. And then you get the width and the breadth of knowledge as much as possible. And third
Mm.
year is when everything is consolidated. You start to understand and put the pieces together a little bit more. And you know how they say that the more you know, the more you realize you don't know? That
Mm.
I think is normal and healthy. So don't be too overwhelmed with the fact that you don't know a lot when you realize how much you actually don't know and how much is out there. That's
Mm.
actually what keeps you safe most of the time, I think.
Yeah, there can be this tremendous amount of imposter syndrome, can't there? Like, should I really be doing this, but you've had the training, you know what's going on. Now, look, one question that I think often comes up, we have, as I said, 13 different specialties in Australia. One of them's oral medicine, and one of them's oral pathology. What's the difference? I've had a lot of people ask, and I've seen some people describe themselves as, this oral medicine and oral pathology. Can you clear it up for us?
Yeah, no, definitely. So this is a very, very common thing that comes up that I see all the time. So essentially, oral medicine is a clinical practice. So we see patients. We are
Mm,
basically at the, we're basically at the coal face of seeing patients. So I see
mm,
patients every day that I'm in clinical practice.
mm,
The scope of oral medicine, which is been, redefined, which I think a lot of people don't really understand the scope of oral medicine. We see obviously patients with oral mucosal disease. We see patients with oral facial pain conditions, salivary gland disorders, medically complex patients. So basically, anything that is not really tooth or gum related could fall within the realm of oral medicine. So I think that
mm,
sometimes there's a bit of misconception with that.
mm,
Oral pathologists are specialists in diagnosing conditions. So generally, most oral pathologists are not actually seeing patients clinically. So, for
mm,
example, if I were to do a biopsy and
mm,
I would want someone to look at the histopathological slides and do an evaluation, I would usually request an oral pathologist have a look at my slides to help me with the diagnosis. So
right.
that's generally the difference. But
Mm,
the confusion is that as of a few years ago, it's changed now. The oral medicine degree was actually called oral medicine oral pathology. There is actually no difference, or at least in my experience from the people that I went through, there
mm,
is no difference
mm,
whether the degree says oral medicine oral pathology, because the training's actually the same. So to be an oral pathologist, there
mm.
is a 3-year Doctor of Clinical Dentistry course, but generally then you would need to do further training with the Royal College of Pathologists.
Okay.
Yes,
That's good. That clears that up. You started to talk about the scope of oral medicine, and you're right. It seems to be something that's expanding in some way, because I used to think of oral medicine purely as various mucosal diseases and problems like that. But of course, now there's sleep problems, there's TMJ problems, there's pain, chronic pain, which I think a lot of oral medicine specialists get involved with too. Is that correct?
yeah, so I'm not sure how far this dates back, but I remember when I was in undergraduate, doing dentistry in Melbourne, orofacial pain, dental sleep medicine, and temporomandibular joint disorders was actually taught by oral medicine. But I think maybe where the confusion is different universities teach different things, and different specialists have different areas of interest.
Mm,
So, for example, one of my colleagues, he's an oral medicine specialist, but he doesn't see any oral mucosal problems. He has limited his practice to seeing oral facial
mm,
pain and mandibular joint disorders
right.
and
Yeah.
sleep issues. So I think sometimes it really depends on where you're based and who's around you. And I think that can be confusing. But for the younger generation, now with the fellowship of the Oral Medicine Academy of Australasia, and
Mm.
we've got like accreditation, standardized syllabus, it is something that we have to demonstrate competencies in each of these realms to be called a oral medicine specialist.
So you're doing your 3 years. You finally got there. You finally finished your 3 years, and you're a newly minted little oral med specialist. So where'd you go? What happened? Tell us your story after that.
Yes. So one of the things that I do encourage people to think about if they are interested in in all specialties, but in this case oral medicine, is to actually think about what you want to do afterwards. Because a lot of people are very focused on getting into the training course, which I understand because it can be competitive, but you have to consider what you want to do for the rest of your career and where you're willing to move to and what opportunities there are. So,
Mm,
for example, with oral medicine, obviously there are private practices and you can go into private practice. But
mm,
say, like, if you're like most oral medicine specialists would want to do a bit of work in the public sector because we see different cases there. Some people will want to go into academia. You may actually have to consider if there is any public positions where you want to be, how competitive jobs will be, and whether there are any university positions, any universities where you are. I do have a few people who want to do oral medicine and they are interested in regional and remote oral medicine services, which is excellent, and I completely applaud and support that. But sometimes the issue is that if you have your heart set on working in a section of Australia that doesn't have the population to sustain your oral medicine practice, that is also an issue. So
Mm,
I think the good thing would be to sort of have a little bit of a think about what you want to do when you finish graduating, and then see if you're actually flexible to move to different capital cities, if you
mm,
want to do, tele-oral medicine. And I think that's really important. So, for example, in some places, not as much in oral med because there is a lot of demand for oral med, but I know, for example, for some specialties, if you are interested in having a consultant position in a public hospital, that is really, really difficult to come by. So
right.
you sort of consider where you are and where you can move to, and
Mm,
if you've got family support and all of that sort of stuff. So I think that's important. So definitely have a think about that.
mm,
I knew that I wanted to do a little bit of everything because I do like the variety in what I do at the moment, which is maybe why I end up doing a lot of different things, like with different, I teach a little bit and I do private
mm,
in public practice, but I always knew I liked the variety, and that part of that was the attraction for me for oral medicine as well, was that you
mm,
never quite know what's going to walk through your door. So
mm,
I did have the flexibility to move to different places, and I did have the flexibility to work in a range of different sectors. So when I first graduated, the first thing I sort of thought about was what I wanted to do and where had the opportunities and where had the jobs. For me, quite luckily, things worked out in Perth for me to get the positions that I was hoping for. Um, I didn't get some of these positions straight away. Sometimes, and I'm not sure if this is the same in different specialties, but
mm,
sometimes you have to do like a little bit of pro bono work, or like do rotations and things like that for them to see who you are and what services you can actually offer before then a public position opens up. But
mm.
that was something that my husband and I decided that we would stay in Perth to try to make it work. But if all of the positions in Perth were filled, then I would have had to look at moving to a different capital city. And luckily for us, we did have that flexibility.
Well, look, the question I was going to ask is what are your favourite aspects of being an oral med specialist? But I think you kind of mentioned some of them there, the flexibility that it gives you. You do some teaching, you do some. Now, you're very big on the social media. I think it's excellent. You put some wonderful posts up there, which are quite informative. So I think that's fantastic. Last couple of things. I want to ask, what's a typical day look like for an oral med specialist? Well, for you, what's your morning routine? What time do you get up, and what time do you get to practice, and how's it all look?
So the good thing about, in my case, as my life as an oral medicine specialist, is that it's a little bit different, which I quite enjoy. So one of the things that I've said before is that sometimes I never quite know what's going to walk in through the door.
Mm,
It could be a mucosa case, it could be a really unusual case. I like the variety. So when I'm working in private practice, I usually get up. I'm not a morning person, so I usually get up at 7:45 and rush out the door by 8. First patient by 8:30, and then
mm,
I see a full day of patients, and it could be anything really that comes through the door,
mm,
which I quite enjoy. I only work in clinical practice about 2 or 3 days a week at the moment. But one of the things that I would say for oral medicine, and I suppose for other specialties in general
mm,
dentists as well, I think sometimes there is a little bit of pressure to feel like you have to work 5 or 6 days clinical. I think that is a lot. So I'm actually very happy doing 3 or 4 days clinical for me, one day as an admin day, because as a specialist, there's so many letters to write, things to do from the administrative side. So I quite like the balance that I have where I teach one day, have
mm,
one day as admin. And then a couple of days a month in public
mm,
practice and then some in private practice. So
mm,
I think one of the beautiful things about dentistry is that we don't have to do full-time practice if that's not what we want to. So I think, especially for the younger dentists, like please don't
mm,
feel that you have to work 6 days a week to be
mm,
successful. That's a
mm.
quick way to burn out. So
Brilliant.
yeah, so typical day, I see patients. And then in my role at the Children's Hospital, I also see patients. Sometimes I have registrars come through with me. who are currently training to do oral medicine. And
mm,
then I am a lecturer at the moment at Curtin University. I do the oral medicine unit. So
mm,
I do a little bit of lecturing on the side, which I really quite enjoy as well, because
mm,
oral medicine is extremely interesting to me. So I quite like
mm.
to share that.
Thanks for that. Now, to wrap it all up, what advice would you give to someone who's maybe a dental student or younger dentist or any age really, I suppose, who's actually thinking possibly about oral medicine, doing it as a specialty? Um, they're trying to work out the plus and minus, whatever. But overall, what would your advice be? Just
Yeah.
go for it, I suppose.
Yeah. So my probably biggest pieces of advice is to first make sure that oral medicine is actually what you think it is, because
Mm,
typically in dentistry you don't get as much contact with oral medicine as say you would with endo or perio. You may not actually be sure what an oral medicine specialist does, and that's completely fine because there are not that many of us. So one of the things that I would recommend is to make sure that you know what you're getting yourself into. So I
mm,
would encourage things like doing a rotation at oral medicine clinic, speaking to the oral medicine registrars, speaking to the specialists, speaking to the head of training. If you want to make your application to oral medicine strong, I personally don't think that your undergraduate or your dentistry results matter that much. I think you have to show a keen interest in oral medicine. So attending oral medicine courses, oral medicine CPD is quite important. I think demonstrating the capability for further study is probably a good idea. Things like the primaries, or if you've done some research or masters, all of that I think will be really helpful.
mm,
We have discussed thinking about what you want to do after you finish. So
mm,
that I think is always worthwhile considering, for future
mm,
planning. Make sure that you do have some financial support. I was quite lucky because I was married by by the time that I did oral medicine. So my husband didn't have a choice. He had to support me. But I was very lucky and I recognize that
mm,
because it's not easy. It happened to a few of my colleagues. It's not easy and it's not fun to run into financial issues in your, final year when you find out that you actually have to pay to sit some of these exams. Rent may go up, especially if
mm,
you with. So having a good savings buffer, I think, is a really good idea
mm,
as well. Oh, just because it's one of those things that the last thing you want to do is, be in your final year and
mm,
then having to worry about whether you need to defer the course or not to save up more money. And it does happen. I understand because
mm,
expenses, cost of living is going higher at the moment. But having a
mm.
good buffer is really
Yeah.
helpful. Yes.
Yeah.
Yeah.
One thing about oral medicine, when I think about it, of course, though, is it is one area where you may have to give some bad news to a patient. You are the guys that dentists refer when they see something that looks
Mm.
a bit strange, and you actually do the biopsy. And you actually so that is a different element to what most dentists have to do. Tell me a little bit about that. How do you handle that? And during your training, were you taught how to give this kind of news?
We are. It does definitely form a part of our training. I suppose to a small or to a smaller extent, dentists do know how to do it because usually you would have to give bad news like teeth need to come out or something's unrestorable. In terms of a cancer diagnosis, this is something that we are definitely trained to do, and the setting is quite important. So if we have to give someone not great news, we usually try to make sure that we have enough time, it's in a private location, things are written down, future plans are given for patients. So
Mm,
for example, if I give my patient a negative result or a cancer diagnosis, I always like to tell them that their next appointment will be with whoever. Sometimes it can be head and neck surgeon,
mm,
at the local hospital at 3 p.m. in a week's time. So I
mm,
think giving the patient that sort of step by step process can be really helpful. I
mm,
usually like them to bring someone with them.
mm,
I think I'm at the point of my career where I do have experience in knowing when something is more than likely going to be cancerous. In
mm,
most cases, at the appointment when I do the biopsy, I will try to preempt it with the patient a little bit. I would say something along the lines of, I'm a little bit worried. If you want to come next time with someone, please feel free to
mm,
bring someone with you. That way,
mm,
they are a little bit prepared
mm,
as well. But I think it
mm,
is quite important to have things written down for them because a lot of times when you're giving bad news, they can't absorb everything that you said, that
mm,
you have enough time. It's in a private location, so your receptionist or your nurse knows not to come in during that consult time.
Mm,
and then basically just giving patients, permission to call you or contact you if you've said something and they heard it but they can't remember what you said.
mm,
And that usually helps patients cope because they know what the next step will be. So when they
mm.
go home and they share with the family the bad news, they'll be like, look, this was the diagnosis. And then most times the family would ask, well, where do we go from here? And they will go, oh, I've got an appointment with Dr. So and so next week at 3 p.m. And I find that is comforting for the patients to know what the
Mm.
next steps are.
Okay, well, yeah, look, that's a great explanation of how you go about that, because that is something that you would face on a semi-regular basis, I assume. Well, look, thanks for going through all that. Now, is there anything you want to say in summary? In fact, and can you also tell us where people can follow you on Instagram, whatever, because you do put some good stuff up there. Everyone should know about and follow you. So
Thank you
let
very
us know.
much. So my Instagram is at oral medicine oral pathology, and on Facebook it's a spoonful of oral medicine. So I usually post content up, and I can be reached at those social media handles.
Okay, brilliant. Well, look, Amanda, thanks so much for joining us today. I think you've really explained what it's like to become an oral med specialist, and to explain, some of the things that you face, and how your training went. So brilliant. Hopefully the viewers will get a lot out of that.
Thank you very much. Thanks.
Brilliant. Thanks. Bye.
Bye.
Well, thank you very much for joining us. I hope you enjoyed this episode. Please remember to subscribe and like. Have a great day. Thanks.